Meet Dr. Tosin Odunsi, a dedicated OBGYN on a mission to empower women everywhere. With her passion for providing accurate and reliable information, Dr. Odunsi is fighting against the spread of misinformation in the world of women's health. Her goal is to help women make informed decisions about their bodies, their health, and their future. So join Dr. Odunsi as she shares her expertise and empowers you to take control of your health journey.
Here's what we're getting wrong about vaginas. The first is the anatomy. And I think that from the beginning, meaning as children, we're not taught what to look for. We're not taught about the anatomy. Well, I took basic science, meaning high school science, and I didn't remember anything from it. It wasn't until I got to medical school where we did a deep dive into the reproductive anatomy. That's where I learned the different parts. So what we get wrong is knowing our bodies. The vagina, that's the inside. The vulva is anything on the outside, meaning the skin. And then the vestibule is where the two meet. It's kind of like a door. So if you were to stand outside of a library, the vulva would be anything outside of that doorway. And then the library itself would be the vagina. And then the vestibule would be the door that you have to walk through to get from the outside to the inside. And I think if you understand that basic anatomy, you're able to understand when people say the different parts of the reproductive system that, okay, I'm passing through the door now, or I'm coming out of the door. That'll really be helpful. Now let's talk about discharge. I am surprised at how much discharge is a hot topic because as a gynecologist, I see this every day. And this is one of the top questions that I get. Is this normal? Is this okay? So let's break that down. The pH of the vagina is 3.5 to 4.5. And what does that mean? That means it's more on the acidic side. So anything that actually raises the pH of the vagina may increase the risk of infection. And the vulva, when we talk about anatomy, the vulva is the skin that's outside of the vagina. That's actually a pH a little bit higher than the vagina. So when we talk about placing things inside the vagina from the outside, that's where we can have pH disturbances. So what is normal discharge? Normal discharge can be clear, white, a little bit creamy. Where it gets to be abnormal is where it's clumpy. And we use the term cottage cheese. So if you're seeing cottage cheese discharge, that can set off a little signal that maybe something is going on and it's possibly a yeast infection, especially when that's accompanied with itching and inflammation from scratching a lot. The other part of discharge that we have to know is quantity. How much is too much? How much is too little? And this can change depending on where you are in your cycle. The average discharge amount is 3 to 5 milliliters per day. And that seems like a lot, but it's not. What is considered a lot would be if you were soaking through one of those panty liners, then I'd probably bring that up with a gynecologist. But if you have regular, clear, or slightly creamy discharge, and it's on a pad, that's perfectly fine. Where we may want to bring it up with our gynecologist is where you see blood outside of a period, because that means maybe something else is going on with the lining of the uterus, or if the color changes to a darker yellow, a greenish discharge. And then the third thing we have to know with discharge is the odor. Now, you don't have to smell like a tropical paradise. You don't have to smell like flowers and roses. The vagina smells like vagina, and that's not going to be a nice drink. I mean, I wish it was a nice drink, but a lot of the products in stores, they're targeting you to make you feel like there's something wrong if you don't smell like that. So I just wanted to reassure you that you don't have to smell like a tropical paradise. As long as you are keeping the outside clean, you don't actually have to put anything inside the vagina to make it smell fresh or all the buzzwords that are used to sell products. This is such an important topic because many of my patients think they need to clean the vagina with special products, and that's not true. The vagina is a self-cleaning oven, and you don't need to place anything special there. It'll take care of itself, and that's what produces discharge. And discharge is composed of skin cells, bacteria, There's water in there, so you don't have to do anything, especially since discharge, when it's clear or a bit creamy, that is normal. One of the questions you asked me at the beginning was, what are we misunderstanding or doing wrong with vaginal health? One of the things we're doing wrong is not fact checking and understanding the source of where information is coming from. So the reason why I started this channel is because I wanted to make sure that you received evidence-based medicine. And I believe that every woman deserves to know the facts and know the truth. And the more knowledge you have about your body, the more empowered you'll feel to, number one, discuss this with family members, discuss this with friends, and also come to the gynecologist feeling like you can have a conversation and know that you understand your body as fully as you can. And I just wanted to make sure that you're able to question the source and determine, is this information making me feel bad about my body? Does it go with the norms of what the vagina does, what the vulva does, what the vestibule does? Does this go in line with, does this make me feel good about myself? And the way education works, good education is you should feel better about your body and understanding your body. I hope you enjoyed this video. This is fun and exciting for me. And if you want to see more, then make sure to subscribe and keep watching.